Medical situation that will shock you.
Absolutely. In the last 4 years at a hospital in Brooklyn, there have been 3 women who have died during childbirth. All of the women were black. There are striking racial disparities at some area hospitals. Black women are 9 times more likely to die from pregnancy or childbirth than white women in New York City.
And now a movement to try to pass a law to make hospitals accountable for women who die giving birth. Investigative reporter Kristen Thorne live at Woodhull Hospital in Bed-Stuy with this story. Kristen.
Well, Bill and Sade, the Grieving Families Act would address a lot of things. One of them would make hospitals accountable for providing emotional damages to people who suffer this sort of tragedy. We want to talk about Woodhull Hospital. It has been less than a year that I was here telling you about yet another woman who died while giving childbirth, and here we are again talking about yet another woman. Beverly Garcia Barrios appeared to be a healthy 24-year-old pregnant woman, but that all changed last month when she came to Woodhull Hospital. She wasn't feeling well. Doctors rushed her in for an emergency C-section. The father of her child never saw Barrios again.
The doctor just said that she has to go in, and then after that they come with the news that she was gone.
Nelson Ramirez still doesn't know what exactly happened to her.
I want exactly the same answer.
3 black women have tragically died during childbirth at NYC's Woodhull Hospital in Brooklyn over the past 4 years, raising significant concerns about maternal health and systemic disparities. 1. Christine Fields, 2023. Fields died from hemorrhaging following an emergency C-section. Her family has filed a $41 million lawsuit alleging negligence by the hospital. Advocates have called for systemic changes to improve care for black women who face disproportionately higher maternal mortality rates. Her case has inspired a push for legislation such as the Grieving Families Act to allow lawsuits for emotional damages. 2. Sha'Asia Washington, 2020. Washington, a 26-year-old paraprofessional, died after receiving an improperly administered epidural during childbirth, which led to cardiac arrest. The anesthesiologist involved lost their medical license. Washington's death sparked protests and highlighted the broader issue of black maternal mortality. Her legacy has been commemorated through murals and memorials in Brooklyn. 3. Beverly Garcia Barrios, 2024. The most recent case occurred in September 2024, involving complications after an emergency C-section. Her death underscores the ongoing risks faced by women of color during childbirth in New York City, where black women are 9 times more likely to die from pregnancy-related causes compared to their white counterparts. These incidents have fueled advocacy for improved maternal care, greater accountability, and systemic reforms to address medical racism and maternal health disparities. Efforts include pushing for better data transparency and expanded access to birthing centers and midwifery care. You can explore sources like BK Reader and related healthcare advocacy reports for more details.